Let's discuss today the 5 A's model, which is a useful approach for tobacco use disorder treatment. Number 1, ask. We should ask all the patient about their tobacco use, be their past or current use. It is seen that smoking the first cigarette within 30 minutes of waking up or smoking over 20 cigarettes in a day may suggest more dependent users. Number 2, advice. We should advise the patient to quit. Again, this should be with an individualized message for each patient. For example, we may tell the patient that quitting smoking may be the most important thing which you may be doing to your health. Number 3, assess. We should assess the patient's desire to quit. For example, we can ask, what are your thoughts about quitting? Number 4, assist. We should assist the patient and different strategies can be used, such as setting a quit date, using medication, using psychotherapy. And number 5, arrange follow-up to support the cessation as well as to prevent the relapse. So this was the 5 A's model. Hope it was useful. Thank you very much. May God bless you.